Welcome back. So this presentation, we're going to talk about how do survivors cope. Past histories of traumatic issues, all of these things can impact how we as advocates respond and what we respond to. It's important also to remember that everyone copes in their own unique ways. No two people are going to cope the same way. Today we'll look at some of those more common coping mechanisms, but it's important to remember that this is not everything on the list, and we are all unique. Alright, so I got a question for you guys. You have experienced a really big loss. What have you called upon for your strength? How have you coped? What helped you? Who helped you? And what wasn't helpful? In the midst of deep pain and trauma, we often naturally look to the pain. One of the tools of advocacy includes bringing out the strength and that we all carry within inside of us somewhere. Somewhere we have just that little bit of strength. We need to rely on that, but we also need to rely on each other to figure out the answer to these questions. Things to consider when we talk about coping mechanisms. Depending on what the victim or survivor is calling for, it's always important to listen and assess what it is they need and want the outcome to be. Usually this can be discerned by careful listening and allowing the person to share freely, but sometimes you maybe need to be more directive or specific with your questions or responses. The one thing that no one ever needs is to be shamed or feel bad about the ways they have coped in the past. Honor their courage for reaching out. Talk about how brave it was to take the risk and contact us. Normalizing a behavior isn't the same as condoning it. Say something like, a lot of people turn to alcohol to numb the pain and to cope. And that worked for a while, but it sounds like it isn't working for you anymore. Perhaps we could talk about some other ways to cope. So just some ideal triggers that might affect a victim or survivor, such as pregnancy, dentist office, medical procedures, anniversaries, large life events like marriage or death, season change, child turning the same age as they were when they were victimized. They often feel a loss of control. People invading your personal space, reminders of the incidents, being told what to do. It isn't only after an event that people are triggered. Often there are other times that may cause survivors to need more support. Also be aware of that to reduce their impact. Alright, so we're talking about mind, body, and spirit next. So mind is the person may be forgetful because of the stress. Are you writing a to-do list? Are you closing your mind when it's appropriate? Have you identified what is garbage in your mind and how are you getting rid of it. You know, we all have those things where we just need to like kind of take a step back and really think, and this is one of those moments. Body. Are we taking care of our bodies? Are we exercising enough? Are we drinking enough water? Do we have good foods? Not working out too much? Are we stretching? Doing yoga? Are you breathing deeply? Are you using these, as they may not be simple sometimes, but maybe just trying them might help. So when we're talking about spirit, we're not directly talking about like religion and all that. So, your body needs enough oxygen to, during a crisis, to kind of clear your vision and get through it. Just kind of taking that time just to visualize yourself, maybe in a good place, a safe place to you, and really just building that up and learning how to get through that crisis and just rely on that good place you're visualizing. Here are some practical techniques. I would urge you guys just to practice these just a couple times and see how it works for you. Alright, sometimes survivors cope in ways that aren't as healthy or healing, but they are doing the best they can. However, this is incredibly important for survivors to hear from advocates that what they are experiencing is normal and the ways they are coping do not make them crazy. Normalizing feelings and methods of coping with sexual violence reduces the shame to the survivor. Survivors of sexual assault are 5.3 times more likely than non-survivors to use prescription drugs for non-medical purposes, 3.4 times more likely to use marijuana, 6.4 more times likely to use cocaine. Think about those statistics and how, if you haven't survived trauma, how much more these are increased if you have experienced sexual violence. Got some more numbers for you here. 10 times more likely to use harder drugs other than cocaine. 79% of survivors who drank alcohol became intoxicated for the first time after the assault. 89% of survivors who used cocaine used it for the first time after the assault. If this is something a survivor brings up that they have been drinking, ask them if it's been more than usual. Are they concerned, or has someone else expressed their concern? Know who to refer, AA groups, NA groups, online resources. Use the non-judgmental approach when working with victims who are consuming drugs and alcohol to cope. If substance abuse is a past issue, sexual assault could affect sobriety. So in a study of male survivors sexually abused by children, over 80% had a history of substance abuse, 50% had suicidal thoughts, 23% had attempted suicide, and almost 70% have received some psychological treatment. This is huge, especially when we're talking about men and male survivors. So women who have been raped are far twice likely to suffer from bulimia nervosa or binge eating disorder. It's just because they're exerting control over what they're eating. They're deciding when they can eat, what they can eat, how much they can eat, denying themselves when they're hungry, punishing themselves for feelings or memories that they have of the abuse by not eating or purging, working through the hunger, surviving on very little amounts of food. Accomplishing these things can feel like victories in gaining control over their lives and bodies after sexual assault or abuse that took the control and choice away that they once had. Some survivors and victims may deny themselves food in order to become thin and lose any resemblance of the female figure. So then that way, they're not seeing themselves as attractive, and nobody would want to hurt them again like that. Other victims may gain weight to hide areas of their body or attempt to make themselves unattractive. We know that sexual violence does not occur because of sexual attraction, but some victims and survivors may feel that it makes themselves less physically or sexually appealing and may ward off the attention from perpetrators. They may hope it will lessen the risk of experiencing sexual violence again. This is all so true. So we can separate suicide attempts and self-injury by considering whether the person is trying to end all the pain or trying to feel better. There are times where self-injury goes further than intended and the injury becomes life-threatening. In addition, these feelings and situations that lead someone to cope or seek relief by self-injuring could later lead them to attempting suicide. So, although it is important to realize that self-injury and suicide are not the same, it is important to help the person who self-injures find more long-term solutions to coping with their situation. So, how do we respond to this? Depending on our level of comfort and skill, it's important to know when to refer out and when other resources, because this, along with many other things, is a dangerous form of coping. Do not tell the survivor to stop, but help the survivor find other ways to cope. Talk with the person about a safety plan the next time they want to self-injure. Explore what has helped them and hasn't helped them in the past. Help them identify the times that they were more likely to self-injure. Think about how you might react if you found out a victim or survivor was self-injuring. Be careful not to show disgust, disbelief, shock, or frustration. Assess the suicidal risk and remembering that the self-injury is not a suicide attempt. Help the victim explore why they may be self-injuring and what they want to do about it. Just begging to talk about how they are feeling. We are just beginning to talk about how they are feeling and can help lessen the need to self-injure. And do a self-harm contract. A lot of self-harm contracts are done with a therapist, but you can just look them up on Google and you will find many different forms of those. Alright, that was a couple of deep slides there. So what are some other ways that we can cope, or victims and survivors can cope? Crying is healthy. We do not cry enough. Cry it out. Let it just flow, right? Animals are a great source of healing. Eating well and taking care of our bodies during these times are great ways to cope. Going for a walk. Maybe just laying in the grass. Or, welcome to Minnesota. Go lay in the snow. Give you a little shock. Just getting outside, enjoying the little things. If you can't, read a book. Coloring, adult coloring books, of course, my fave. You can even go on the internet and look up millions of different coping skills. Maybe there's a small list that you can work with the victim or survivor on and seeing if they like any of those ideas. So this one I want to touch base on. Burning a letter to the perpetrator. It's also important to acknowledge that sometimes the anger can be at other places. Mom for not believing, a friend for not being supportive, or a church community for not responding. So burning a letter to your perpetrator essentially shows control, power, and forgetting. not so much forgetting, burning it up, putting it where it belongs, giving yourself that little bit of power back. So when we look at this picture, burn a letter to the perpetrator, we do this at our night to unite, not giving the perpetrator the power or to give him the understanding or control or any form of that. It's essentially giving power back to yourself.